Dr. Holly here. We're outside in our lovely California home here, so we're losing sunlight, but we wanted to do this outside. So you may hear a buzzing of an airplane or something coming by. I apologize, but I don't normally do too many videos of me doing the presentation. So this is kind of I don't know if it's a treat or not, but here's what we're going to do. So I wanted to start off. This is Jody. Wave Jody. She's a massage therapist. She used to incorporate a lot of stretching in with her massages, and it really helped. And as a physician with my clients, I would see more people coming in because of lack of range of motion, lack of being able to stretch. And then a shortened muscle, when you put it under a load or a demand, it automatically starts pulling, starts wreaking havoc. You start getting fibro tissue adhesions, scar tissue adhesions, and everything else going on. So I thought it'd be really cool to kind of demonstrate some things that we did in my clinic or studio that helped out on our clients, our mutual clients, and that we've seen firsthand. One of the things right off the bat, and then we're going to I'm going to keep this, if you guys know my presentation style, it's very informal, okay? So you're going to see us laughing. We may have some outtakes, bloopers, who knows? One of the things I like to do is some subscapular work right around the shoulder, posterior shoulder girdle here. One of the best ways that I have found is two ways. Actually, I'll show you one while Jody's just like this. Is we would actually have their arm down beside them, and we have like a little foam wedge, or you can even put a towel. My hands are cold, aren't they? So we'll have a towel put under the anterior portion of the shoulder, and that will actually lift the shoulder up. Then we can get under there and work. Now, if I come on that side to work it, I'm obviously going to be in front of the camera. So we'll go this way, and I'll show you guys kind of what we're talking about. We'll lift up, and even if the towel or the pillow isn't enough, you can put your hand under here. And I normally start down here, because up here you're not going to get a lot of space. I normally start down here where the space is, and you can actually walk Jody's girdle right around here. And I'll kind of come in and go up under just a little bit, and I'll just feel. I'm not going to massage or stretch it. I'm just putting tension, and what I'm feeling for is a gardening reflex. If she doesn't have the gardening reflex, it tells me she's relaxed, and I'll start gently pushing across and start working the tissue. Now, a lot of you guys already do this. There's another one that really get into. If you could face me on the side, Joe, I'm going to show what I term is the meat hook. And we'll drop the arm behind her, and that brings that, and then I take my palm, and you can really see the hand just bury up underneath the scapula. And then what we do, I get into what's called a scissor stance, and I lift up. And I'm putting pressure, equal pressure forward and up, so my hands are kind of canceling out the forces of each other. You feel that working? And I see a lot of people really liking this, and the things that I see more of is more right-handed shoulders. Any idea why right-handed nowadays? Computer work, working with the mouse. After about 15-20 minutes, if they have the elbow free floating in the air, the levator scapula starts contracting, and starts bringing it up a little bit more, and it starts retracting the shoulder in. So I see a lot of this stuff mainly on the right side. Also, we have a lot of factory workers. If they have a position that they're working at a factory or something, and they're predominantly one-sided on an assembly line, you'll find a unilateral thing. But I always get up under theirs and just go right up in, and you can actually lift them off the table with it. That's why I call it the meat hook. So that's it for that stretch for that. Those are the two that we use. So we'll go ahead and pause now. We'll come back with another one. All right, now we're back. Another one here that I wanted to show you guys that we did. A lot of with the pec work we would do. Jody just stated she would start off with the face, the head, the neck, and she'd work in with releasing some of the pec muscles. If you find adhesions, knots, nodules, things like that, we're not going to get up in the axillary region. But what I wanted to do is show you what I used to do also whenever I'd be working with a lot of the pec muscles and trying to stretch them. First of all, I would want to check, very simply, I'm using this hand not only as an anchor, but just to feel the joint under me. The elbow supported, and I'm just rotating the humerus, the arm. I'm wanting to feel the range. I'm looking for joint mice, crepitus, any type of hinge problems, ball and socket problems, anything in the joints. And if it's all clear, then I get a baseline right here of her range of motion. See, she's starting to get tight here. How I can feel it, I'm not feeling it on this one. I'm feeling the pec tie-in right here under my hand starting to tighten up. So then we'll come on around, she starts to get tight. I can feel it loosen there. So that's her range of motion. That is what you call end range of motion. Joint play, end play. So what we want to do is take the subject, Jody, right to the end range, and then we want to anchor and try to stretch a little bit more, okay? We're going to talk in the slide portion about ART, PNF, and using the end range of motion as well. So right now what I'll do, so her end is right there. I'm going to come in just in front of the head of the humerus, go in and go on the pec muscle where it ties in. And I'm going to anchor that. Then I'm going to straighten the arm out. And I'm going to bring it down a little bit more. How's it? Can you feel a stretch?
Yes.
Pretty good?
Yes.
Then we'll come on up and I'm going to get another bite. We're going to go a little bit deeper out. Can you feel that? Mm-hmm. And I can feel it under my hand. When I start feeling fasciculations, a little tightness, then that's when I stop. Reason being that you stop when you start feeling that is because the muscle has to relax to actually get into a full stretch position. If it's fasciculating and starting to guard against, you're not going to get the stretch. And you can work the whole pec muscle all the way from the periphery all the way into central that way, okay? And there's another one you can actually do that we used to do a lot of times is just the rotator cuff muscles, making sure they're stretched out. That's more of a joint range of motion that we would do, not so much a stretch for the rotator. There's a slide in there that has a broomstick handle for the subscapularis that you can do the stretch on to start stretching that after massages. I'll make sure that's included in my slide presentation. So that gives a good one right there. Another one, come on around that way, Amber. Our camera woman is actually Amber. She's filming this. So we'll come on around. We stretch this, we stretch the pec, and now if we wanted to stretch the cervical extensors and some of the suboccipital muscles up here. Obviously, you guys know you want to cup your hands up under the subocciput. Many of you guys are doing this, and I can feel the base of it right here, about down by your mastoid. And I'll put a little traction, and then I want to check her range of motion. And I'll bring her around very simply, and we'll do both sides to get a stretch. And then what I want to do is come on around. Right here's where I want to anchor, but I want to anchor here, but I want to go a little bit below. So I want to anchor and tissue pull up. That's going to give a stretch. This is my landing point right there, but I want to go right below it, tissue pull up. Then I got her. She's right in my hand. She ain't going anyplace. Then I want to take the shoulder, drop the shoulder, and she's already getting a stretch right there, aren't you, Jody?
Yes.
Then I want to slowly rotate and lift the head up, and she's getting a pretty good stretch. Now, if I was trying to gain range of motion with her, at this point, I'd take her to the end and I'd have her just simply raise her shoulder up, and I keep the head still. So let me demonstrate that. Raise the shoulder up, and I'll bring your shoulder this way. Bring it this way. There you go. Then drop her down, take it back, okay, hold it. Then on the third one, I normally have them go pretty hard. Bring up, hold it, 3, 2, 1, then relax, and then you'll get a little bit more stretch at the end range. And you can do that all the way through. It's a contract release technique. So I would start with doing that and then switch over to the pecs and work my way down. If you really have a person, your hands aren't strong enough, or you have a person with a really big head like I got a big noodle on top, you can take your forearm and come underneath and anchor right here, just like this. And on top of my forearm, her subocciput's going to sit. This hand is just a guide. And what you could do, actually I got it the wrong way. I got to go this way if I'm going to be in the camera. So we're going to go up, anchor. I'm going to come over. I'm going to lift up, and I'm using my whole body weight to lift up. You feel that?
Feels better.
You like this one better?
Mm-hmm.
Okay. Same thing on this. Now we're going to stretch this side, and when I stand up, it's not straight, it's going to be standing that way. You feel that? And I'm just using standing up. I'm not using any force at all. And you can direct this hand to turn her head more if you want more of a scaling. If you want more of the posterior stretching, this is the guide to help you with the muscles. Very easy to do. Okay? That'll conclude that.
Go.
All right, now we have the test dummy subject, Jody, laying on her side. We want to do a quick lat stretch, and obviously stretching the lats is always hard, especially the upper lat and the lower lat. The best way that we've seen, that there's a few ways to stretch them, but the best one that we've seen when they're on the table is to just do a sideline. You can have them on their back, come up, wing it on the side. You can have them land on their stomach, drop the arm off the table, then do a stretch like a swimmer's stretch. You can do those. But just to be easier, I like this one better because you have both hands on the subject and on the muscle you're stretching, so you can feel for fasciculations. And I'll show you a couple variations of that. So basically we're going to take her up and over, okay? If you want to really get a stretch, you can get a bolster or a small pillow and put under the side to create a bowing effect of the thorax, okay? But what you used to do this a lot with the bodybuilders, right? When they would come in, they do the lat pull downs and stuff. So you want to take the arm, and you don't want to leave the hand in this position. You want to actually turn the arm like that, okay? Then you can take your hand, put right on the top part of the lat, and drop down as you go down. And it's about a third down, then the rest is going to be down, third in, and the rest will be downward pressure. You'll have lotion on your hand, so you come on down, and as the arm goes down, first of all, just check for the range of motion. You're starting to stop right there, aren't you? Starting to get a little tight. That's where I can feel it under here. Her joint's going to go more, but this is starting to pull right there. So we would start here, and as soon as I start to feel it getting tight, I start rocking my hand down. That's what we do. If we have the arm this way and do it, it's uncomfortable, isn't it?
Yes.
So we'll bring it this way, and we'll drop her on down. And you want to keep the arm straight. You don't want to be bending it as much, okay? If you have a severe tight one, then you can hook under and you can bend it. You take away the long lever fulcrum. You're breaking the kinetic chain, and you're just doing little stretches, and use your body weight and just stretch as you do it. Now, you used to use your forearms a lot. You would take and do the forearms as you did it. Okay, that's a good one for the lats. If you find as you're going over, you find a trigger point, obviously go ahead and have them just kind of hold their arm there and relax, kind of work the trigger point as you go in. Just be careful of going up in the axillary region with lymph nodes and everything else. And if you guys took my lymph webinar, you'd know what I'm talking about. All right, that's it for that one. All right, so now we're going to work the piriformis glute region. This is one that I did a lot in my clinic because I worked with disc pathology, and whenever you have a disc pathology, the secondary thing is always a peripheral entrapment syndrome. So we did a lot of PTs, peripheral entrapment syndromes here, or PSs, peripheral entrapment syndrome. And basically, we all know that the spine comes down. We have the triangle bone, the tailbone right here, the sacrum, and we have from the lesser trochanter of the leg, your piriformis and a lot of your glute muscles will tie in and come around and attach to the sacrum here. So if they're tight, we can pinch the sciatic nerve coming around. The other thing you can see in a client whenever they're in their swing phase, if this is their feet and they're walking, if they have a tight piriformis, one of their feet will be bowing out when they're in their swing phase. This piriformis is pulling it out, so we want to stretch the piriformis. One of the easiest ways, and Jody made a good comment as we were preparing for this, she said first, whenever you're doing this, make sure that you warm up the glute muscles, that you warm up the area really good before you go in and start stretching. So one of the best ones that we do on this, if Jody was already warmed up, and obviously you'd have proper draping and everything else, is you find the border of the sacrum, then we'd be walking the muscle, and if you want to find the muscle, just kind of have it passively work, and I can feel it right under my thumb. Can you feel it, Joe? Mm-hmm. And you can feel it right under your thumb, okay? So what I want to do is I want to start at the base, I want to rotate it in, because when I rotate it in, I'm putting slack and I'm tightening it up when I bring it in like this. So I want to grab it right by the base, bring it in, and I want to go down a third, midline 2/3 at the same time. Now I'm going to hold this, and then I'm going to bring the leg slowly out, and I can feel the muscle rolling under my thumb. Then we want to come back slow, down, in, and bring it out. How's that pressure? And we'll work this all the way out. Now, as you get out by the acetabular notch and the head of the trochanter down here, or the lesser trochanter where it ties in, it's going to get more sensitive and more palpable tenderness. So you want to be careful when you go down there. Work the whole muscle down, then you want to flush it out. Just do some good flushing after you stretch it. And that'll do in micro stretch. That's how you isolate the muscle to do the micro stretch. Now, if you want to do a really proficient stretch that ties the glute and some of the ham in, Joe, can you lay on your side? You want the pillow? What we do is we'll hold the leg, same thing, and what I want to do is create slack in the muscle. I bring this up, the muscle slackens, find the tailbone, in and down toward the tailbone, and I want to bring this leg up around, and then all I want to do is anchor this as I squat down. Then I'll come on around and we'll do another drop, same thing. If you want to get really intense, what you can do is take the foot, extend the foot, hold it, and internal rotate, and do that. Then you really stretch all this. Is that too much, or you feel it stretching? Feels good. Keep it going. So you can get the premise. It's all about angles. That's what judo is based off of, to be honest with you. So we have that. That is a very good one. On your back, please. The next one, if we're working on the leg, and I'll do this leg to save from the camera, is to come on up. I like to cup them. Now, if they have lotion and everything else, you don't get lotion, you can't do it. So you'll probably anchor the knee joint and feel the knee joint and monitor, and you get right above the ankle in this one. And what I like to do is come in just about where it's a little bit past the 90-degree mark, and then I start rotating in. You can start feeling that right there. We need to start stretching you more. So right there, Jody's getting tight with the rotation. And then once I feel her start to get a little tight, that's when I stop. And then I go up as one unit. And you can really, she's closing her eyes, so that means she can really feel it. Then we'll hold it for a minute, and we have them breathe. We monitor their breathing. That's one way to do that, then come back. Let them kind of rest a second, do the same thing, and go up. The other way is to come on up, turn, then come up. You say when. Okay, now push back against me, and you hold it. 2, 1, relax. Then you can go a little more. Push back against me. 3, 2, 1, relax, and you can go a little more. So each time you do that, you bite off a little bit more, and you can get it going a little bit more. Does that feel all right? Mm-hmm. Now, we got that. Now, the other one that I like to do is have them cross the legs, and they will come over, and I anchor on the hip right here. I'm sorry, on the shoulder, excuse me. Then I put my thumb right under the back of the knee for the web. Then I'll just rotate around. I'll finish it off with that. Can you feel that stretch? Now, if they have a hip replacement or acetabular syndrome or some type of other, like AVN disease, avascular necrosis in the femur head, you don't want to do this one, because that's how you dislocate a hip. Dislocate a hip is flexion, internal rotation. That's how the hip comes out. So we don't want to do that. But normal clients coming on in, after you do the piriformis, the glute stretch, have them on the back, just anchor and bring up around. It's a good long lever stretch. They really like that, okay? So now once you do the external parts out here, you want to work the internal stuff. One of the best ones that I have found is I bring the leg right above the kneecap, the patella, just put it right above where the patient is comfortable, and relax. Is that relaxed?
Yes. Okay.
So you see this is up pretty high. Jody is very tight here. So what we want to do is find the ASIS anchor, and then just simply bring this leg down. You feel that? Mm-hmm. Then you have her relax and push up on me. Go ahead. Then I hold it. 3, 2, 1. Relax, and then down slow. You feel that stretching? Mm-hmm. So that, and you'll do that on both sides. That's working the ball and socket, the little internal muscles holding that together. It's going to be stretching some of the fascia adhesions on that. That is really good. The other one, if a person we're working down the kinetic chain, is the hamstrings. So if we're going to work hamstrings, the typical one is to come on up and stretch like that. What I advise, that's okay. I don't mind doing that, but normally the ones that are coming in, they need stretching. They're really, really acute. Instead of stretching the long, full fulcrum, the kinetic chain, break the kinetic chain and just stretch this part. How you do that, so say if Jody could only go up, you say when. See, she's pretty tight already, and I haven't even flexed the foot yet. Okay, so we're keeping the, but that's pretty tight right there. So what I would do on Jody is come down a little bit, break the kinetic chain, come up and hold the knee, the leg, the upper part of the leg in that position, and then just stretch this part. You say when? Now, curl it back under. See, she's going to do that motion. Go ahead. And I would resist it. Relax. Go up a little bit more. Go down. A little bit more. One more time. Do it 3 times. Okay. And you can see she actually got farther doing that than doing the full lever all at once. Now obviously you know the old way, if you guys wanted to, you can put it on your shoulder, anchor it, lock the knee, and come up. And then you can also bring the foot up at the same time you're doing it. That really intensifies it. I like doing it the other way. It's easier on the client until they get really going and they're really limber. Then you can just do the regular old-fashioned hamstrings this way, okay? While she's here, I was going to show you the quad one that we used to do in the clinic, because you really want to stretch the quads. The easiest way I found to stretch the quads for the clients is after you're working on the quads, you do the cross, getting the fascial bundles and the quads worked, warmed up, and doing whatever you normally do. Then if you want to stretch them, the easiest thing is have them hitched toward the end of the table. Come on around here, Am. And normally I'd have a rolly stool, but I would take the leg, I'd support the knee, and then I would just bring the quad up. You feel that? Then I would hold it. And if they're tight, then you have them extend the leg. Go ahead. And you resist it, relax, and you bring it back more. You could also do this at the same time. I'm going to come in front. As you're coming around, you can put a bolster right here, hanging out, and you can bring the leg down as you're going up. You can bring it down and work it that way. That there's working all the muscles all the way down. That's a good, okay? And it's just a good stretch, and you can bring her on up, squat, and use your legs to stretch it up. Okay? She's pretty good in her quads, or it's her hands that's tight. So why don't you flip over and I'll show a calf one. And I'm going to need you to probably come on down where your feet are hanging up. A little bit more. Come on. There we go. One of the best ways that I found to get the calves is to probably come on around over here. So if we're going to get the calves, the easiest way to keep your hands free is to have the feet hang off about 6 inches. And what you want to do is just, if I extend my knee, just bend my knee, it's going to automatically stretch her calf without me even touching, okay? So that's all I'm doing. So right now, I have my hands free to do whatever I want. So I want to start at the base, and I'm just feeling the play in the muscle. So what I'm feeling on Jody right now is her lateral head is a lot more restrictive, a lot more tighter than her inner head. Okay, so I'm going to really focus on this with more pressure. So what I'll do, I'll have lotion. I don't have it out here, but I'll have lotion. Then we'll start at the bottom and we'll slowly bend my leg as I'm working up. Okay? Then we'll ratchet it all the way up. Can you feel that? Mm-hmm. And we'll go all the way up. You can even take the palms if you want. And you can go deep pressure, and you can get the soleus and the gastrocs at the same time, okay? Then when you get up in the popliteal area, because of the nerve, the vascular bundle in the popliteal area, just kind of lighten up and feather off, okay? And that is a great stretch. Now, the other thing you can do is if you find an adhesion or a restriction, if it's really restricted, come up on it, park on it as she's flexed, then you tell her go ahead and straighten her toe out, and you resist it. Relax, then you go a little bit more. Straighten. Relax, go a little bit more, and you can really stretch. Again, because you can see just anatomically, you're really stretching the Achilles, you're stretching these. Make sure you warm them up really good before you go on that. So I hope that helps on that. Cut.
You like them to have a bolster or not?
When I do what, the calves?
No, on the feet.
To hold it up?
Yeah.
Yeah. Thank you. All right, I often get asked on this because some of my background, I actually went to osteopathic school. I was in the podiatry program. I was going to be a foot and ankle surgeon, so I know a little bit about the foot. And I started adjusting a lot of the feet that came into our clinic, and we almost had a foot practice for a while. There's 26 movable bones in the foot, so you get one or two little misalignments, subluxations on it, you start adjusting them, and it can make a big difference in the person's overall body. So one of the things I get asked on is how do we stretch for plantar fasciitis? That is huge. And I've seen some on Facebook on the online forums that they have the tennis ball, the golf ball, what do we do? And, it's a mystery, different shoes, arches. Here's what we did that really, really worked, okay? First of all, have the client lay down on their back. And what you want to do is put a bolster under the legs to kind of get the feet up a little bit, okay? So normally with plantar fasciitis, what happens is you have the remnants of the Achilles come out around, the fascia will go up and it'll attach up on the balls of the feet, okay? So whenever that does, to find out if they have, so the telltale signs is when they first get up, the first 5 to 10 steps is just murder because it's all shortened from being in bed at night. Then when they get up, it stretches out and it pulls on those bands and they react, okay? So it's really, really painful. Normally the pain is just anterior to the calcaneus right up here, just right up to the head up here. That's where the pain is. So don't dig in on that spot. So first you have to isolate which band it is. So what we want to do is, normally I do it the opposite hand, but we'll do it this way. You want to take, and you just want to extend the toes back, and you can see, just by doing that, see Jody's one band right there is coming up. So we want to open that up, and it feels almost like a guitar string, really tight. And there'll be little bands, 4 to 5 little bands, and the one that's going to be the culprit that's causing the majority of the problems will appear, okay? So what you want to do then is you want to find that band. You want to hold the toes. The band is right here. I can feel it under my thumb. When it comes down right to where the problem area is, you want to be right there. Relax the toes. You want to put slack in the toes, and then you want to anchor with this thumb. You want to anchor that band to the calcaneus. Then slowly start stretching and flexing the toes out. Can you feel that, Joe?
Yeah.
Okay, then you want to get another bite. Anchor, flex the toes out. Anchor, flex the toes out, okay? You want to work that band, or if there's multiple bands, you want to work that through that. The next part 2 phase is you want to get a good grasp, and you want to do a cross friction all the way across those bands. Now I'm not going in, I'm going across, just enough to grab it and go across, and you'll work those 3 or 4 times up and down, then you'll go back and you'll re-stretch. That alone, after doing that a few times, will start loosening that plantar fascia, will start breaking it up so the person can have better mobility in the morning. It's not as tight. You'll break up the adhesions. Then for the first week, you have them start off on a tennis ball at their desk or sitting in a chair and just rolling the tennis ball. Then the second week, if all's going good, then you go to a golf ball, start rolling. Doesn't do any good to start off on the balls first unless you get in there and break up those adhesions, okay? That's the best way that I've found to work with plantar fasciitis. Later on in my years, I actually started doing what's called Lodi taping, where we take the white masking tape, the athletic tape around, then we would actually tape it and bring up the arch, and we'd put some spray goop on their feet, and they'd wear it for about a week. But early in the years, just that alone solved a lot of cases, okay? Now that's not preventing the spur. You know, the spur basically is after prolonged chronic of the plantar fascia, pulling on the bone will start forming a spur because of the pulling. You can't cure the spur, but normally the spur isn't what's causing the pain. It's still the inflammation of the fascia, hence plantar fasciitis. So that is that one. I want to show you another one that we used to do in our clinic a lot. I mentioned earlier when Jody was on her stomach when she was prone, that with a tight piriformis glute muscle, the leg will start rotating out, okay, because it's tight and it's pulling them around. So one of the things that an old Eider-Off technique was called log rolling. So what you want to do is have the leg in, and you can actually come under, start at the patella region, grab it. Don't grab the patella. You want to go right above the kneecap, anchor, and roll inward. Then you have Jody roll her leg out. Go ahead. And as the leg slides around, you provide a little resistance. Okay? Relax it. Same thing. Roll it out. Do that 2 or 3 times. Then have them relax and reassess the leg, and you'll start seeing it start to go back inward. That's called a log rolling technique. You can actually watch, there's other videos on it on YouTube. Take a look at that, because that will actually help you finish things off. Okay? Anything else that we wanted to hit for the stretches that you did that I haven't mentioned? The lumbar. What was one of your better ones that you liked for the lumbar? Is that on the side and holding the back and bringing it?
Cradling, belly there.
Okay. One of the ones that Jody liked, it wasn't a long lever lumbar stretch. It was more of a micro stretch. We'd come on around, grab the ASIS, we'd hook it. Then we would take here and we would kind of go, instead of going up, we'd kind of go cross and anchor and bring that up as we do that. Can you feel that in the back? Okay. You don't want the piezoform of your hand right on the spinous process. That's painful. So instead you want the meaty flesh part just lateral to the spinous process of the lumbar. Hook. And it's not so much a firm downward pressure. We don't want to create a kidney problem here. We want to go down a third, then traction upward. At the same time, we're rotating and pulling downward. Then you can go on up. And you may feel some cavitations. You may feel some releases, because you're really working. This is actually an orthopedic test that you can do. It's called the Farfan maneuver.